Minute attempt to re-examine the controversial awarding of medical marijuana licenses and to quickly get the product to patients died in the Georgia Senate last night.
Yeah, the Georgia Medical Cannabis Commission now goes back to resolving 16 from companies that argue the process was overly political and fatally flawed. Senior I-Team reporter Dale Russell has been covering the medical marijuana rollout for months and is here with the latest. Dale?
Courtney, a lot going on last night. Monday night laid a compromise House Senate bill that would have assigned a state office to resolve all the protests and get medical marijuana to patients by June, passed in the House but was tabled by the Senate.
I'm really disappointed.
Well, all those in favor of tabling 1425 vote yay, oppose nay. The Secretary will unlock the machine.
Late Monday night, a compromised House Senate bill that would have a state office resolve all bid protests and set early June as the deadline to award 6 licenses passed in the House but was voted down in the Senate.
On the motion, the yeas are 28, the nays are 27, and House Bill 1425 has been placed on the table.
A frustrating end for many to a lengthy battle to get medical marijuana quickly into the hands of some 20,000 patients in need.
We've been trying to get this done here in Georgia for about 7-8 years now, and it's still not done.
Now the state goes back to the beginning, awarding licenses to the original 6 companies, licenses that were shrouded in secrecy, controversy, protests, and a lawsuit.
The state of Georgia had 3 years and accomplished nothing.
Dale Jackson is a longtime medical marijuana advocate fighting to get product for his son with autism. He was also part of a team that bid and lost.
It's an abomination to the families of Georgia how messed up this commission is and how leadership has failed the families of Georgia.
For 7 months, the I-Team has investigated the awarding of medical marijuana licenses in Georgia. We've exposed controversial corporate backgrounds involving 4 of the winning bidders. One bidder was Atlanta entrepreneur Paul Judge's company, TheraTrue. Weeks after he was selected for one of the lucrative licenses, Paul Judge contributed $50,000 to Governor Brian Kemp's leadership committee. We also reported how thousands of pages of winning bids by law were redacted and kept secret from losing bidders, the public, and the media. The scoring of those winning bids by politically appointed commissioners was also kept secret. Kept secret from the public, the media, and even legislators.
The way in which this new agency was rolled out was so egregious. It was horrible.
Section 14 is the meat of it and the big change.
The compromise bill promised to use a state agency to evaluate all the protests, as well as the original proposals, so the Medical Cannabis Commission could award 6 licenses by early June. It also added 3 more licenses for the near future. The House voted yes, but the Senate shot it down. So the controversial medical marijuana bid process, bogged down by 16 protests, will once again continue. A shame for all the patients waiting for their medicine, said Representative Ben Watson during debate.
We've been working on this for 10 years. We have not gotten this oil to the children that they deserve. That is what the children of the state of Georgia and all those registrants deserve, getting that oil to them.
Now, throughout the day, I've talked to a number of stakeholders in this battle, and it looks like the fight is far from over. Everyone who feels the judging was too political and too secretive still want to fix what they believe is a flawed selection process. I'm told people are looking to the executive branch, legislative branch, and even the legal system. Russ, Courtney, there's a lot of money at stake with these licenses.
Yeah, and this has been a long, convoluted process, but hearing from that father, it really drives it home that this is affecting a lot of patients.
There are so many patients, like his son, so many others in the state of Georgia that have waited so long for this opportunity to have medical marijuana available to their children. It works very well with certain diseases, as I think most people agree. This is very hard and frustrating for them.
Yeah. Transparency is not too much to ask for in this circumstance.
There was little to no transparency in this bid process. Right. I've never seen so many documents, material redacted as we saw in this.
Right. You know, you'll stay on it. Thank you, friend.